Welcome, everybody. This is Feature Friday with the Austin Wellness Collaborative, and my name is Hasael Martinez. I'm the webmaster and main admin for AWC Facebook group, and Ashley Maltz, of course, is our founder. Today we have Laura Farb. She's a licensed acupuncturist and clinical nutritionist, and she's been practicing acupuncture for over 14 years and also has a background in massage therapy. Laura, go ahead and introduce yourself and tell us about what you do and how you got started in it.
Hi, everyone. So let's see. I've been licensed for about 14 years. I went to school in Austin, Texas at the Academy of Oriental Medicine at Austin, which is now AOMA Graduate School of Integrative Medicine. I got into holistic medicine in my 20s, just on a path of exploring sustainable ways of living and health practices. And I kind of went diverted from my Ivy League school college background and where a lot of people went to Wall Street and, had other similar professions in the business world, to traveling the world for a few years and then coming back and kind of starting the path through massage therapy. And so did that probably for over a decade, and then decided around when I was 30 to go to graduate school for Chinese medicine. And I've been loving it ever since. It's really, it's always changing and growing as our, health issues are changing and growing, unfortunately, in some ways. I'm never bored. I love it. There are different modalities within Asian medicine. And, as far as herbs, acupuncture, there's moxibustion, there's different bodywork techniques. And then my particular interest has gone into clinical nutrition. And for me, that means part of that has been years and years of training with Standard Process and MediHerb, a company that focuses on whole food-based supplements that they grow at their farm. Most of the products come from their farm in Wisconsin. The herbal line comes out of Australia, and they've been around since 1929. So, I just found in grad school that I was always talking to people about nutrition and diet, because really that's foundationally where we all have to start. And until you kind of get that down, or some foundational things, it doesn't matter how many herbs you take, how much acupuncture you have, if your lifestyle is creating an issue. That's where I try to work with people, is holistically, and look at the whole picture. And then just to add one more thing, I do some quantitative testing. I can help with blood work from a functional perspective, as well as do some hair mineral tests. And that's just taking a sample of hair to burn it to ash and looking at the different ratios of minerals to tell about what's going on with your health.
Yeah, that makes a lot of sense. Yeah, and I think it's unfortunately, sooner or later, I think we all get to the point where we have to be more interested in these things as far as holistic wellness, and, depending on whoever you go to for your traditional therapies or not traditional therapies, and you have to start getting more and more interested in it, because unfortunately not everybody's going to be giving you the same kind of service and really taking into account, like you said, your life and everything that you have going on. So I was wondering, during your travels, did you have any specific experiences during the time that you were traveling that directly, influenced your practice?
Actually, and what started the whole, the launch pad was, I was a work scholar at the Esalen Institute in Northern California when I was 24 years old. So that just radically opened my entire world to just things I had never heard of, modalities, sustainable farming, environmental issues, and then holistic body works, holistic psychotherapy. So that was pivotal. I would say that was really where I launched off from. And then just through my own personal health journey, seeing that, long-term solutions like antibiotics and steroids to even opioids or pain relievers, they're not going to ultimately treat the cause. And not everyone's interested in doing that. However, just to clarify, I am absolutely on board with Western medicine. So, you know, if
Okay.
something gets really severe, like emergency medicine is fabulous, you know, Western clinical pharmacology and an ER if you need it.
Yeah.
But really what most people aren't dealing with is foundational health issues that are leading to the issue. And even in the time of COVID, you know, people are talking and realizing that it's the underlying health issues that are creating a lot of the problem with the overreaction to the virus. So, um,
Yeah, I know
yeah,
that makes a lot of sense. No, and it is important for you to kind of make that distinction and also say that, you know, there are, you know, times that you should really be going to like an ER or things like that. Um, and especially for people like me who, you know, I'm kind of new to a lot of this stuff, and I'm sure a lot of people that may be watching, you know, through our page, you know, maybe they're not familiar with acupuncture or, you know, uh,
right.
other Chinese medicines and things. So that, no, it's good
Yeah, and
to
actually that brings
clarify
up
that.
a point of a patient I'm currently who's been in my practice a while, but he was in my practice before he had cancer and then going through um, chemotherapy and liver cancer. And, you know, he considers me one whole, you know, very much integrated in his wellness care. So there are his Western doctors who do the disease management, and that is not my forte or specialty. But yeah, that really we work together to keep him well and deal with the symptom management. Obviously I can't, you know, bring back part of his liver and, you know, structurally, but I can help his quality, which I have, help his quality of life and give him sort of a sanctuary to come to actually restore and feel at peace and lessen anxiety and, you know, all the intensity that's around the constant barrage of treatments and checks. And so, yeah, so that's been really gratifying.
Yeah, definitely. And you know, whenever I hear kind of stories of people with cancer, you know, and their kind of journeys through that, I always remember my grandma. She passed away, but you know, ultimately, uh, you know, the doctors that we had been working with, they gave up on her, and in the end, we ended up turning to nutrition, which actually, you know, she was actually able to reverse a lot of the symptoms. Unfortunately, it was too late by that point, but like you said, you can't restore, you know, the function of a liver or something once it's already gone. But you know, it's just so important for people to start,
Better quality,
you
yeah.
know, taking better quality holistic care and being proactive about it. And so it's, you know, it's that's why I'm happy to help promote people like you know, that are doing this kind of work.
Yeah, thanks.
And so can you tell us about, as far as this year, of course, you know, the pandemic, you know, it's affecting everybody and it's affecting everybody's businesses. Tell me how everything's going for you and what kind of changes you've made.
Yeah, it was really intense in the beginning, and I ended up having to give up my office, which in the beginning I was really distraught over. Very, you know, it was very stressful. And I loved the office I was in, the people I worked with. However, I didn't feel like I could really control the environment as much, with a lot of people coming and going and the cleanliness of just, you know, maintaining a standard that I could control. So the silver lining has been that I moved my practice to my home office. And during the summer, at least through July and August, and actually even up until really just a few days ago, we've been outside on the deck. So with masks on, and it's been awesome.
Yeah.
It's a huge backyard, really beautiful and green, and it's felt really safe. People have felt safe coming here. And then now we're moving in, but I have screens installed. There's cross circulation with the windows being open, and
Mm-hmm.
different heaters and fans, and then just sanitization. I allow enough time, about half hour between each patient, so for the circulation of the air and just to sanitize everything. So that's kind of how, at least for now, I'm practicing out of my home and created a home office. And yeah, people have enjoyed it. I was nervous at first, but it's been working and I'm really
Yeah.
enjoying it. So yeah, now I'm getting to the point where I feel comfortable really getting the word out, which is why, you know, also I wanted to do the talk with you and feel comfortable, because yes, it is a home space, and but it feels yeah, it feels peaceful and also safe. So
Yeah.
until, you know, until I guess I grow to a certain point where that's not manageable. For now, it just feels like it's been a great solution.
Nice. Yeah, that's good. It sounds really nice to be outside too. I'm sure,
Yeah.
maybe some of the treatments you want to be inside, but it seems like a lot of them would be, just more peaceful and calm to be out
Yeah, it's been quiet, and the birds, and, you know, you hear different creatures and woodpeckers, and
there.
it's, you know, mosquitoes were a little bit of a, you have to kind of deal a little bit with mosquitoes in Austin, but
Yeah.
um,
But I
yeah,
think,
they're quite, yeah, it's good.
yeah, overall, it sounds like it would, a little bit of nature therapy included for free.
Totally. Yeah, totally.
Yeah, that's awesome. So, tell me about, one of the things that a lot of people have been realizing this year with the pandemic is, not just underlying health issues, but also kind of mental health, stress, anxiety, these.
I think, at least in my clients, that's the biggest thing I've seen, which will lead me into sharing why, which we'll talk about why I want to do a cleanse right now.
Mhm.
But the mental health issue included for me at a point, just sort of being, you know, at the time single and at my house alone. And it was a little much, you know, I mean, there are only so many educational, you know, Chinese medicine webinars I could watch, and so many, you know, FaceTime calls with friends. So yeah, I think with people I see, you know, I think all of us have seen, there's friends and clients I have with kids who are trying to work from home, people who aren't working because, you know, they're in the service industries or different
Mhm.
reasons they've lost their jobs. Yeah, just a multitude of stressors. We're having to deal with intergenerational family and with kids, and then the going out and dealing with just even basic things like grocery shopping. Yeah, the mental stress about just sort of the future and all the unknowns has been a big deal. So, and I personally have also found relief through having acupuncture. So yeah, it's wonderful modality. It's
Right.
really simple, and it gives immediate relief for whatever it is. Um, so yeah,
Yeah.
that was, I forget what the initial question was, but
Yeah, no, I was just asking about kind of the stress and anxiety and kind of perhaps
right,
treatments for coronavirus, not for
right,
coronavirus,
right, right.
but
Yeah,
because
in
of
this
the
environment.
stress and anxiety of, the pandemic.
Yeah.
Um,
Yeah, and how I've helped, yeah, how helping too, just with that, not only the mental health aspect, but also just dialing people out with what they need for supplements or Chinese herbs, so that they feel like they have kind of a home pharmacy um, to take care of things if they start to feel run down or even have allergies.
right.
And then, which I was saying about the cleanse, I got really motivated recently to, I want to lead a cleanse with my clients or whomever's interested, because that to me is foundational for getting back on track with sleep habits and weight loss. As you know, maybe the COVID 5 or 15 has happened for most of us. And so yeah, just kind of getting some structure back with that, and also cleansing going into a deeper winter period.
Right.
You know, the cold weather isn't necessarily the most ideal time. In Chinese medicine, we don't want to fast right now,
Mhm.
but just cleansing in terms of cleaning up, like getting out sugar and caffeine and just any kind of processed foods. So I want to help people. There's a cleanse through Standard Process that I love that's completely based on whole foods, and just sort of taking people on that 3-week journey and making it just to implement better habits so that we can go into the winter with a better immunity.
Yeah, better immunity, better baseline into the.
Yeah, and just kind of let go of that stress of, you know, this is sort of our new normal, so now we
Mhm.
have to kind of re-regulate and let's reorganize and just sort of like kind of pace ourselves.
Right. Yeah, no, that sounds good. So it's largely nutritional
Yeah, the cleanse is definitely
cleansing. Okay.
nutrition. How I'm going to structure it this time is just people can get the cleanse and do that as a standalone.
Mhm.
If even if they're former patients, if they want to come in and get specific advice, or I muscle test with my nutrition practice. So if they want to look at which particular, if they want to add in other formulas or supplements for their unique needs, we can check into that, and we can also muscle test dosages.
Okay.
I know some people can't handle necessarily the recommended dosages of the cleanse starting off. They may have to sort of ramp into it. So that's how I can specifically help. And then, actual acupuncture is wonderful. So if you are having detox symptoms, then acupuncture is just a great way to reset.
Nice. Cool. Yeah, no, that sounds good. And so you said that was coming up this next month.
I'm going to do a webinar, which is again another new avenue for me. But yes, I'm going to do a Zoom on November 12th, and that's going to be in the evening at 6:00, just for an hour. The talk will probably be about 20-25 minutes, and then just allow time for questions. So people can just understand better, what it is.
So it won't be a one-way channel. You're going to present, and then you're going to interact with everybody.
Exactly.
Yeah, that sounds really good.
People can pre-register for that. I'll share with you the flyer. It'll have the link. And always, I'm still old school, there's a telephone. People can call or text if they want to know more specifically. I'm happy to chat about that.
That sounds
and
great.
give them information.
All right. That's great. This is a bunch of good info, and hopefully, everybody gets their baseline, for the before it gets too hard to do it later. And so it's good to hear that you're going to help people out with that. Go ahead and let everybody know where to find you on the web.
Yes, my website's laurafarb.com, and my Facebook page is Laura Farb L.Ac, which is licensed acupuncturist. And then I have Instagram as laurafarb.acupuncture. I also have a page on LinkedIn, and then the telephone.
Awesome. All right. So yeah, and then I'll include the links for everybody on the announcement for this video. And so yeah, that's basically it. And for anybody else watching that's interested in the Austin Wellness Collaborative, this is what we do. We try to promote, individuals and their practices in the wellness space. And so we're here to form a community and help everybody be successful. Our motto is collaboration over competition. And so that's what we stand for. And so, reach out to us. Our website is austinwellnesscollaborative.org. And we're on Facebook at /Austin Wellness Collaborative. And that'll point you to our public page where you're probably watching this. So, but thanks everybody for watching, and
thanks for hosting. And yes, I've enjoyed being part of AWC and meeting a lot of other great practitioners and networking, and thanks to Ashley. And yes,
definitely thanks to Ashley, which if everybody doesn't know, she's currently locked out of Facebook for a long story, but we'll get her back in there eventually. But yeah, it's great to have you today, and thank you, and look forward to hearing from everybody.
Thanks, Hazael.
Thanks.